Today I'm going to talk about the use of movement screening in a sports athlete. We carried out this assessment on a 26-year-old male who plays Gaelic football, which is a high-intensity field-based sport with similar characteristics to other field sports such as soccer, rugby and Australian rules. The pitch dimensions are approximately 90 metres by 145 metres, and this large pitch influences the energy systems required for the sport. Regular bouts of high-speed running meters are required. Athletic movement patterns include acceleration, deceleration, cutting, jumping and backpedaling. The athlete has 3 years experience competing at senior inter-county level and has a training age of over 10 years. He consistently trains 5 to 6 times a week in both the gym and on the pitch. His primary position is wing half-back, although he can play anywhere within the middle eight. The table on the slide shows data from Malone and colleagues in 2016 detailing the running demands of elite Gaelic footballers. The middle eight positions have more running demands than the full back and the full forward positions. The level of high speed running and number of accelerations required would indicate that these players should be explosive and there should be a high demand on their posterior chain. The athlete has an unfortunate history of injuries, including long-standing issues with both hamstrings. The right hamstring has been injured more often and may be weaker than the left. Soft tissue tears, along with a diagnosis of pain in the right hamstring extending from his sciatic nerve, have been the athlete's injury prognosis. The athlete has undertaken various rehab protocols including physiotherapy, soft tissue massage, acupuncture and hamstring strength work. The athlete has been given cortisone injections on 3 separate occasions to help with pain from the sciatic nerve. In the past 6 months, the athlete has also developed Achilles tendinopathy and has received physiotherapy for the injury. At the time of testing, he reports no hamstring or Achilles pain. After assessing the athlete's injury history and the profile of their sport, there are several areas to focus on. We need to delve into their hamstring issues and try to see if there was any muscle weaknesses or flexibility issues. So the first string I administered was the active straight leg raise to highlight if there was limited range of motion about the hip joint due to tight hamstrings. Historical research from Worrell and colleagues in 1991 concluded that a lack of flexibility in the hamstring is an indication of injury risk in athletes. However, more up-to-date research such as that from Van Durmel and colleagues and Monair and colleagues, both published in 2016, argued that hamstring flexibility doesn't relate to hamstring injury. Taking all this into account, we believe that testing for hamstring flexibility is still good practice and helps to build a picture of the athlete's capabilities in the targeted area. We next wanted to decipher if there was any muscle imbalances between their gluteal and hamstring muscles, using the active insufficiency test. If this screen indicates the athlete is overloading their hamstrings instead of using the gluteals, it may explain why their hamstrings are susceptible to injury. A case-controlled study in 2017 by Schuurmans and colleagues established that subjects who activate their gluteal muscles more during the front swing phase of sprinting are less susceptible to hamstring injury. More recently, the athlete has developed Achilles tendinopathy. This was during the summer months where the pitch was extremely hard and they had just come through pre-season where large load was placed on their Achilles through track and road running. We decided to administer the Slough wall test to determine if a lack of calf flexibility attributed to the Achilles injury. In 1991, Reynolds and Worrell described poor flexibility in the calf area as a possible cause of Achilles tendon issues, indicating the tendon takes on more load due to the calf's limitations. The athlete's history of lower limb soft tissue muscle and tendon issues, we decided to administer the LESS test to examine if these past injuries impact on their jumping and landing mechanics. The idea of this was to ensure they are still able to perform these athletic movements without risk to the knee joints, despite having issues elsewhere. Screens were carried out in the athlete's club gym. They were asked to complete a full 24 hours rest prior to testing. The athlete was not required to carry out a full warm-up as the tests were low impact and any pre-test stretching would impact on the results. A Samsung S20 camera phone and a tripod was used to carry out recordings. For the active straight leg raise, 2 tape markers were placed on the wall. The first was 90 degrees from the hip joint and the second was 70 degrees from the hip joint. This was the area designated as a pass for the test. The angles were measured using a goniometer. The athlete was asked to lie on their back on the physio table with their arms by their side and hip bone in line with the marked tape. They were then instructed to raise their leg as high as possible without bending their knee and keeping their non-tested knee fully extended. The tested leg failed to pass 70 degrees line, then the result is a positive one. For the active insufficiency test, the athlete was instructed to lay on their back with their arms across their chest and the edge of a physio table with the knees flexed to 90 degrees and feet resting on a flat surface. They were then instructed to perform a glute bridge for 20 repetitions and verbally describe which area they felt was doing the most work. The athlete then had 3 minutes rest where they were instructed to repeat the test using a single leg instead of a double leg. Again, the athlete was to indicate which area they felt was working harder. For the Slayes wall test, a strip of tape was marked out on the ground 10 cm away from a box. The athlete was instructed to start upright half kneeling on a soft surface with their big toe at the 10 cm mark. When they were cued, they were to try to touch the box with their knee without raising their heel. Recordings were taken from a side profile and above the knee to capture any failings. For the modified Les test, a landing area was measured using tape on the floor. This was measured out as half the participant's height from the jumping platform. The jumping platform was a timber plyo box which is 30 cm high as per the test standards. The athlete was instructed to start in a neutral stance, jump from the box, aiming to land past the landing strip and immediately jump as high as possible and land again. These were the only instructions, nothing else was communicated about how they should be jumping or landing as per the test standards. The athlete got 2 trials before the test and then recordings were taken of 2 jumps from the side profile and 2 jumps from the front profile. Results were recorded using the Les test score sheet after reviewing the video footage. The athlete was required to raise their leg to over 70 degrees in the active straight leg raise. The images on the right display the full range of motion. The blue lines indicate the 90 and 70 degree markers and the red line indicates the athlete's full range of motion. We can see from the images they failed to reach over 70 degrees and therefore eliciting a positive result. This indicates the athlete has a lack of hamstring flexibility in both legs. In the active insufficiency test, the athlete reported a tired feeling in both hamstrings from the double leg bridge test. This indicates they may be more hamstring dominant. The athlete reported the same on the single leg left side, and then the test was repeated on the right leg. And the athlete's hamstring actually cramped up just after 2 repetitions. Therefore, the test was immediately terminated. The findings from this test suggest the athlete is over-reliant on their hamstrings and has difficulty activating their gluteal muscles. In the Slayes wall test, the athlete moves their heel very slightly off the ground on their right foot. From the camera angle above the knee, it is more apparent that the athlete struggles to track their knee over their second toe, and this could be compensation for keeping their heel on the ground. The left knee touches the wall without any issues, therefore there may be slight tightness in the right calf and nothing of note in the left. The athletes scored an impressive 4 out of 15 in the modified Les test. They demonstrated foot symmetry in their landing with no knee valgus. Their stance remained neutral all through the test, and their initial landing was toe to heel. A very critical eye would suggest very slight lateral movement in the trunk and average displacement about the joints, although overall they showed an excellent example of jump and land mechanics. The athlete is currently on a strength and power program to prepare for their championship. We decided it would use the results of the screens to modify the current program by adding some corrective exercises in the warm-up and some strength exercises for the glutes in their compound lifts. The warm-up started with some glute activation work using mini bands. Sumo walks and monster walks were prescribed and progressions were provided in the form of band placement. According to the findings of Cambridge and colleagues in 2012, moving the band further away from the gluteal muscles created more activation. Therefore, in the first week, the band was started at the knees, then progressively moved to the ankles and then onto the feet in the last 2 weeks. Further progressions may be carried out in the form of heavier or multiple bands. The next part of the warm-up involved hamstring and calf stretching to help improve the lack of flexibility shown by the active straight leg raise and Slayes wall tests. The stretches were performed for 4 repetitions of 45-second holds in accordance with the Branda and Alaya in 2020. We found significant improvement in the hip flexion range of motion using this rep range. Barbell hip thrusts were then used as the athlete's compound strength lift and contrasted with kettlebell swings to improve hip flexion and glute activation. Along with their team program, an extra session focused on gluteal activation and strengthening was administered. Boren and colleagues in 2011 completed a study using electromyographic analysis of gluteal medius and gluteal maximus muscles during 21 different exercises. These exercises were tabulated in rank order of muscle activation of the glute medius and maximus and both muscle groups combined. The exercises selected for the athlete's program were taken from these rank order results and progressions were made until exercises with the largest muscle activations were prescribed in weeks 3 and 4. Reps and sets were also increased to form progressive overload. To conclude, I found that carrying out the 4 movement screens helped paint a more detailed picture of the tested athlete. They have had hamstring problems for a number of years, and with that have come many different treatment methods, including intense physio work and cortisone injections. The active insufficiency test was particularly thought-provoking, and it will be a path to explore for the athlete in the coming months beyond this assignment. The assignment revealed to me that the movement screen is an important tool to help build a profile of an athlete, showing where strengths and weaknesses may lie. However, this is just a tool in a toolbox, and although that it is good practice to include corrective exercises for screening deficiencies, it doesn't guarantee to make the athlete completely robust. A study from Barr argues that screening cannot ever predict injury, and although this may be true, it is still important to carry out movement screening, prescribe corrective exercises to help people move better and be robust in certain athletic movements. Please see a list of references I used to carry out the assignment. Thank you for your attention.